Worst of worst, if a patient get cancer, a life-threatening disease, and patient is in a palliative care. Worst of worst, patient is having HIV and ends up into AIDS stage. Then also that patient will be taken care of by his family and friends. But if the patient is having some psychological illnesses like schizophrenia, bipolar affective disorder, or mental retardation, his own family and even friends are not ready to accept and take care of him. So this has become, mental illness has become a very stigmatized, and people think that once ill, that means he is lifetime ill. He is not going to recover of it. The moral of the story to tell you here is that if a patient is of HIV, maybe to cause maybe anything, but still he gets some attention by his family members, maybe by friends, even by the spouse. But these psychiatric illness patients are very neglected. And first and foremost thing, they lack insight. So first and foremost thing, breaking the denial and acceptance of illness becomes the most critical thing, and nurses plays a major role in it. So accordingly, to raise the awareness about mental health, this World Mental Health Day is celebrated every year. Okay, next slide, please. Okay, significance of World Mental Health Day, global awareness, to make it globally aware that mental illness, we have seen in first year of any graduation course, diploma course, any healthcare provider know that what is health. Health is a complete physical, mental, social, psychological well-being, but psychological and social health are a very least importance given, at least in the developing countries like ours. We are in a stage like where we are not completely developed and where we are not completely developing. That means we don't have a joint families now in our Indian situations. Some of the rural still following it, but urban joint families are not there. Kids are there in the family, and there is no one to share with the, like grandparents. If they are there, kids can share their feelings with them and so on. But the next generation to come will be in a very, very difficult situation, because these kids will be grown up and they will have a problem to whom to share. Then time will come that they will not be able to share their feelings with their parents, even to the spouse, and to whom to share. So global awareness is important. Annual themes each year, different themes are there. This year theme we have already discussed with you. Prioritizing mental health. The day reminds you governments and communities to prioritize mental health, especially post-COVID area. We have seen after post-COVID area, people are becoming more and more health enthusiastic. They started taking care of their physical health. Even they started meeting their family, social needs are met. Even they start meditating, doing prayers and all. So the awareness has been increased. Next slide, please. Move on to next slide, please. Organizers. I don't. Can you please zoom in, please? Okay, types of catastrophes. Now we have a natural disaster, earthquake, floods, pandemic, COVID-19, Ebola virus, influenza virus, man-made catastrophes like war, conflicts, refugee crisis, displacement, terrorism, how to deal with them, barriers to assess stigma of mental illness are not curable. Mental illness are due to demonic possessions. भूतानी धरलं म्हणून होते. असे काही misbelief आहेत. There are even certain conditions like people, if they fall sick, rather than they are taken to the physician, they are taken to the spiritual gurus for treatment. There is nothing bad in going to them, but at the same time, some scientific help has to be given. Even though stigma is removed, infrastructure collapses are there. Now, India has come up with the 2017 Indian Mental Health Care Act, where they have started with Telemanas, very good initiative. With that, they have started even a video calling for 24 into 7 helpline app. Telemanas app is also there. Even though you are trained, people are not. Even though infrastructure might be there, but infrastructure might be there, but trained staffs are not there. Who will be able to give proper counseling? Policy gaps, resources, other things are there. What are the key stakeholders? Nurses are the main key stakeholders. Other healthcare workers, government, NGOs, communities, and volunteers are the key stakeholders. Strategies can be improved. People are to tell about psychological first aid. This year, on this World Mental Health Day, this WHO has released psychological first aid for frontline healthcare providers. After this session, I will provide you with the PDF link option. Telehealth and crisis intervention, mobile mental health units, community resilience training, so on. Desired outcome of this program is to reduce the trauma and stigma behind the mental illness, faster psychological recovery and rehabilitation, empowered communities, sustain mental health support. Next slide, please. Importance of this theme is to raising awareness, highlight the urgent need of mental health services in response to disasters, access to services, ensuring access to mental health services during catastrophic is a crucial. Global perspective, the theme encourages international dialogue regarding mental health services in emergencies has to be taken care of. So if you look at the basic psychiatric illness, that is Alcoholic Anonymous, the proven treatment for rehabilitation and prevention of relapses and long-term management of alcohol dependence is Alcoholic Anonymous group. If you think of Alcoholic Anonymous group, all are people involved in the Alcoholic Anonymous group are alcohol dependents and sober alcohol dependents in them. They don't allow and entertain any healthcare providers because it has been said the person who is suffering from diabetes only he knows the problem and the pain of diabetes. Same thing happens in all psychiatric illnesses. The person who is suffering from psychiatric illness, he only knows, and at the most his near dear ones, his family members only knows what pain he undergoes. So people are open up to the people of their peer. More specifically, they are open up to the people who are having same suffering like them. For example, you might have seen a movie of Sanjay Dutt Munna Bhai where he was having some hallucination, auditory hallucination and visual hallucination of Mahatma Gandhi ji. Many people told him and tried to convince him that you are sick, you are not well, you need a treatment. Mahatma Gandhi ji is not there, but he doesn't listen because he cannot differentiate between the real Mahatma Gandhi ji and whether he is having hallucinations. So asking a person, so normal people cannot understand what problem he is going through. And that usually happens in this condition that people laugh at him. Because these feelings and these pains which person is suffering, mental illness person, whatsoever disease condition, he only knows, and the common people like us, even though healthcare providers cannot judge it. That's why people, mentally ill people, do not prefer to go for this thing help, professional help. So first and foremost thing that psychiatric mentally health providers, mental health service providers needs, they cannot understand the pain, but at least they need to have a deep knowledge and try to understand the patient's condition. Then only the people will come to know. And first and foremost thing, stigma has to be reduced. Next slide, please. Challenges in this crisis, increased mental health needs. We all know we are having Nepal crisis recently. We have war conflicts are going on among Israel, Palestine, Russia, Ukraine, in between India, Pakistan. It's always going on since 1947. And not many things are happening in between. US has stopped importing and put an extra taxes on our this thing. Like many things are happening, business failures, job loss, many other things. It has also been seen ICD 11 has increased, also included this mobile gambling and other things under dependence producing this thing. Increased mental health needs, elevated prevalence of PTSD, anxiety, and depression, infrastructure limitation, lack of necessary mental health infrastructure during crisis, cultural sensitivity, tailoring mental health care to the cultural context of effective intervention. Government has started taking a proper cognizance of same. Even previous till I remember, आता इथे काही अजिंक्य आहिरे आहे जे might be few boys are seen who might be interested in gambling. Gambling in the sense not proper gambling, but that Dream 11 and all. Recently, I will joke apart. I will tell you one thing: Indian cricket men's cricket team, whosoever becomes this thing a sponsor, they are banned. For example, previously Sahara used to sponsor them. You all know the condition of Sahara, what is going on with them. Then later on, Paytm started this thing. They are also not in a good condition. Then Dream 11 becomes a chief sponsor. Nowadays, Apollo Tires is the chief sponsor for them. I don't know what will happen to. This is just for a joke. People wish the attention of audience. Okay. Dream 11 is also banned. Good things are coming up. And otherwise, people were engaged in Dream 11 rather than watching match, enjoying match. They are busy. Whosoever wins, they don't mind. They are just minding about my money. Shall we get double and the cost? What not? They are saying Dream 11 people. I don't know. Okay. Next slide, please. Stages for improvement, training and resources. First, respondents and health professionals should get proper training and resources shall be provided to them. Community engagement. It has been very well said in the psychiatry and psychiatric nursing. Hospitalized care decreases the prognosis of treatment. If you are giving care to the patient at home setting, it has a good prognosis. Because actually this medical council of India previously in this national mental health program they have clearly stated that treat the patient, not only treat, diagnose, screen and treat the patient and rehabilitate the mental ill cases in their natural setting in the community. Because if you see a graph of mental health programs in India, previously Indian Lunacy Act was there 1912, where people, mentally ill people were treated like they are harmful to the society, so they shall be kept separately from a normal population. So rather than keeping them in the society, they were jailed. It was like a mental ill prison. Then Indian Lunacy Act was amended, and somehow that Indian Mental Health Act came in the 1987. They have come up with the good definitions who shall be admitted. Rights of mentally ill peoples were this thing forced and focused by the government. Previous terms like lunatic, mental ill prisoners, they have been removed, and Indian Mental Health Act was started. Still, the problem was hospital treatment was more focused. Even for a ECT, people were admitted in a hospital. But as per recent guideline for ECT, there is absolute no need of admitting patient to the inpatient setting. Patients are admitted only if some emergency cases are needed or if any suicidal tendencies are there, and if patient is not. Even you will look at the mental hospital at Eroda. Previously, IPD was somewhere around 2000 plus. Now they are reduced up to 1200, and they are trying to even reduce the same because as per National Mental Health Program, you shall identify, screen, treat, and diagnose and rehabilitate even patients at their natural setting. National Mental Health Program also focus on deinstitutionalized care. At the same time, they have reduced the inpatient psychiatric beds. The quality of a good hospital is that when they have a larger number of IPD beds other than psychiatry. But in case of psychiatry, you need to show how much community involvement is there, how much you are doing a community work. So, and this will only happen when we take the nearby community into good faith. And this will only not help. You need to develop, have a policy. You need to strengthen the policy. You need to make the government aware that mental is an important thing which needs to be focused. Then only government will pour some budget into it, and you will get a good infrastructure and a good workforce. Next slide. Current mental health status in India as per 2025 guidelines, lifetime prevalence of mental disorder is 13.7 in Indian population. Estimated of around 150 million Indians require active mental health interventions. Adults currently living with mental disorders are 10.6%. It's slightly higher in urban areas, slightly less in the rural areas. Severe mental, out of this 10.6, 2% are having major problems like schizophrenia and bipolar, and 5 to 7% are having comparatively less problem, that is depression, anxiety. 20 to 25% of Indians suffer from mental health issues such as depression, anxiety, or substance abuse. Suicide constitutes 1 in 100 deaths, a leading cause among young people. It has been said that farmers in India are at highest risk of suicide. Next to farmer, my dear friends, the next community comes is the student. Students are at second most highest risk of committing suicide. So you need to take care of your health. As government is already taking care of farmers, I know that is not sufficient. The same way, the community of students is also neglected community in our India, which needs to be properly taken care of. Treatment gap exists. 70 to 92% do not get a proper help, proper psychiatric help. There are only 0.75 psychiatrists per 1 lakh population, and in relation to mental health nurse, there is no such data available. राजनाथ खिला रे झोपू नका उठा. Government has started initiative like telehealth, telemanas, and expansion of Ayushman Bharat scheme. Next slide, please. These references are taken from a latest from ICMR, NIMHAS report, WHO's report 2025, Journal of Comprehensive Health, Mental Health and Indian Youth by Pandey KN, and National Ministry of Health, Ministry of Health and Family Welfare report to 2025. Next slide, please. Government initiative, we have seen National Mental Health Program, which has started long back, but the current focus is on reducing the IPD, starting with the community-based care. So identifying, screening, diagnosing, treating, and rehabilitating patients in their natural setting. Mental Health Care Act has 2017 has come. Focus on right of mental health care and practices against discrimination. Those discrimination has to be given for mentally ill. Training of healthcare professionals, the people. It is basically it has started with go after Indian Lunacy Act and under independence. The government was Board Committee has suggested to start with the Center of Excellence, and as you all know, the health is a responsibility of state, and state government usually under DHS we mental hospitals has run. In our Maharashtra, the mental hospitals are at 4 settings. One is at Nagpur, one is at Pune, Yeroda, other one is at Mumbai, Thane, and the last one is at Ratnagiri. But still, only 4 places, and Maharashtra is a big state. It was not feasible to give care through this thing. And run by two central government, we have NIMAS, but all over India, it is not feasible to go to Bangalore and even at these 4 regional mental hospitals. So government has started an initiative of district hospital psychiatric units where each under each district, and district usually have a DMER hospital run by DMER, which must have at least 50 psychiatric beds, and one psychiatrist has to be appointed, and that role of that psychiatrist is to train the people who are not trained well in psychiatry. Later on, they have found this is also DHPU is also not working, so they have started more focus on a community base. What is existing infrastructure, that is three-tier system available in our India through available PSCs, RH, and subcenters. Government has started propagating the mental health services and accordingly diagnosing and rest of the things up to tertiary care are started providing through RH and PSC subcenters and all. Next slide, please. Not only government NGOs are also contributing, promoting awareness, this providing support services and collaboration with the government. These mental health agencies are working towards it to fight the stigma and so on. It is important. Next slide, please. Next slide, please. These are some of the government agencies and the government programs like telemedicine, 24 into 7 telecounseling, video consult, mobile apps, all states under the Ministry of Health, Central Ministry of Health and Union Territories. They have this telemanas helpline is there. 1.8 million plus calls are handled till now. 53 telemanas sales and self-care and referral apps are available. But even as you all know, even though all people are started using mobiles, UPIs in India, but still there are people who would have limited access to this mobile-based or apps and calling helpline. More further, the advertisement of telemanas has not yet been happen. Even many people doesn't know. Even students said that doesn't know about this telemanas helpline. Then next is our district mental hospital program, district level mental level services. DHPU is there. Quality varies from staff to staff and district to district and state to state. We have extended Ayushman Bharat scheme, where PSCs are upgraded to take care of the mentally ill people. Staff training under medicine and referral availability, local stigma reduction is taken care of by them. The Center of Excellence like NIMHAS in our Maharashtra, we have started with MIMH. Their main role is to train the people who are not trained in psychiatry. Then certain Jivani like program has been started in Kerala, very successful. Even our MUHS has also started a program about counseling and other things. But the other universities are yet to taken care of. This is a college-based student access via self and referral. More than 60,000 in 66 colleges, early intervention about depression, anxiety has been taken care of. But still, there are issues like scaling down, then sustainability, follow-up, funding constraints, and so on. Next slide, please. Challenges, we all know, whatsoever it is, you are lacking in. Please mute yourself. Shortage of mental health care proposing affecting the treatment quality. Limited funding, insufficient funding, hinders the effective mental health program implementation, impacting marginal communities. Stigma. With that, we also have Vedant. Please mute yourself. Stigma around the mental health prevents individual from seeking help, requiring awareness campaign. As per rule and as per ethics, not only ethics but legal rules, we are not allowed to take a photos of patients for research purpose, even for whatever purpose, based on a principle of confidentiality and anonymity. But at sometimes, what happens in general ward, in a medicine ward, surgery ward, patient allow you to take his um, interview, video calling, or whatsoever, with proper consent. That's true. But when it comes to psychiatry, people take an example. If he is having schizophrenia, it's not his fault, but he does not prepare, and his family does not prepare him to get admitted in hospital nearby. For example, in Pune, we have a Chaitanya hospital. Most of the patients admitted are not Pune based. They are native of something outside, maybe from Mumbai and not Pune. So people from Pune are getting admitted for psychiatric help in outside Pune and long distance from Pune because of stigma. The relatives and friends shall not tell that that people was mentally ill, ये पागल ही है, hospital जाके आया. So people have a notion once visiting to mental health professional, even to the frontline healthcare providers, mental health care providers, is like sickness and which cannot be recovered. It's not like that. Then we have cultural stigma and that we have discussed. Okay, move on to next slide, please. Kadam madam, please move on to next slide, please. Organizers, am I audible? I have disconnected. ये वेदांत बोल रहे हैं मगा से.
Audible, sir. Audible, sir.
Next slide, please. Significance, raising public awareness, let the people know that mental health is an important thing. Encourage open discussion involving key influencers. Let the people know that ministers know that mental health is an important. Like gyms are opening for physical health, so mind gym has to be opened. In Pune, they have a very nice place near Sarasbag, behind Sarasbag, where there is no restriction for a good people and artist people to go and sit over there. They will provide you with a pen and colors, crayons, and some colors if they wish to. And people go, but the only thing is that mobile is not allowed. Mobile is not allowed inside. So you have to go there, eat whatever, drink whatever, coffee or whatever you wish to, and they will provide you with the pen, paper, and the crayon material and some watercolor if you wish to, and you need to draw the picture. People are going there, relaxing their mind and coming back. So it's nice, a very nice and enjoyable feeling, because nowadays people are engaged in so many of these social media accounts, then gaming and then gambling, whatnot, rummy and all. So people are not finding time, and people are not, people's mind are not aware what they wish to. Most of the people are feeling burden, like I don't have a time, and most of the people, and at the same time, what work you do, I don't do anything. म्हणजे लोकांना असं झालंय, वेळही नाही आणि कामही नाही, करतात काय दिवसभर, सोशल मीडियावर असतात. ओके, नेक्स्ट स्लाइड प्लीज. Indian celebrities, now these people are also coming out like Deepika Padukone, Anushka Sharma, Alia Bhatt, even Shah Rukh Khan has openly said that he was having some problem of anxiety. Then our Sanjay Dutt also tell that he was having a problem of insomnia and marital disharmony and many issues related to marital issues. And even Honey Singh has come out with the problems of phobias and substance dependence he was suffering from. People are afraid to talk about their problem, but asking for help is not a sign of cowardness. Asking for help when we are in a trouble is a sign of courage. Deepika Padukone has shared her mental health journey, has inspired many to seek health and embrace the vulnerability. And nowadays she works as a this thing ambassador for mental health. Even Vivek Oberoi has given many speeches about substance abuse and cursing, and he is also working towards eradicating substance abuse in for Maharashtra state. Anusha Sharma, she advocates breaking the stigma surrounding the mental health through openness and authenticity. Alia Bhatt has also stated her candid discussion about mental health encourages younger generation to prioritize well-being. What this suggests us, these Indian celebrities talking about mental illness, that it requires a courage to talk about, and it's all right. You have a problem, you share it. Sharing helps at least to bottle up, remove the bottled up feeling. Because if the things are getting bottled up, there is going to be a burst one day. So rather than bursting one day, slowly go on releasing your feelings. Tell your problems with your friend. Have a good friend. Good friend doesn't mean a friend can be your peer group, your colleague, your parents, your spouse, your kids, can be anyone. Next slide, please. So, what is we take away message from the don't worry, my class is not well. Otherwise, we will say after the takeaway message for class. It's not takeaway message from the celebrities. Breaking the stigma through openness, honesty in sharing struggles can help dismantle the mental health stigma in a society. Everyone is having some or the other problem. म्हणून संत तुकाराम महाराज म्हणाले की जगी सर्व सुखी असा कोण म्हणजे सुखी असा कोणीच नाही. Means no one is happy, but once you come up, otherwise people say I am having alcohol dependence, how I will share, people will think I am useless person, I am worthless person. But it's not like that. There are many other peoples. What is happening in alcohol dependence and alcoholic anonymous group, people are thinking like I am an alone sufferer, but it's not like that. When he goes there and people like him start sharing his feelings, then he comes to know, I'm not the alone sufferer. There are many other people who are suffering like me. People only read about Al Anon group. Al Anon group is for the spouses of alcohol dependent. In our Pune, it is Al Anon group is there, which is run by two rooms are there at Garware College, Vimaltai Garware College. At one group, one room, Alcoholic Anonymous group will be means sober alcohol dependence. Only requirement is that you need to have a faith and a need. Even you drink and come, that is also allowed. And the other room, the people, spouses of alcohol dependents are speaking. Being a male person, I always feel proud because Indian male are very lucky. Because in Al-Anon group, wherever they are conducted online or offline, most of the spouses means 99% times spouses are female. In developed countries, the condition is opposite. So whatsoever that stigma has to be broken down. From struggle to strength, celebrities often showcase how overcoming challenges leads to personal growth and resilience. Resilience is bouncing back. Whatsoever bad happened, let it be. In everybody's life happen, that point comes that he fails. The time comes he feels shameless. But the time has to come that he needs to bounce back at any stage. There is no end for this thing. There is a limit for a muscle to grow. There is a limit for bone to grow. But there is no limit for mind to grow. Because the neurons are such a thing that can go at any extent. But there is also a problem. Once neuron related to particular thing are died, they cannot be recovered. So one need to go on fostering, learning new things, giving time to yourself. माझ्या डोक्यावर खूप लोड आहे, मला फॅमिलीचा लोड आहे, ह्याचा लोड आहे, कॉलेजचा लोड आहे, अभ्यास आहे. Give time to yourself. Do whatever you like to do. You like to do only reading Facebook and gambling that or smoking, that will not help. Try to think what you used to do in a childhood. Try to do that thing. Each person shall have at least one hobby. खाली दिमाग शैतान का घर होता है, तो कुछ ना कुछ चालू रहना चाहिए, अदरवाइज यू विल गेट डिमेंशिया अर्लियर. So take care of your hobbies. In our guidance and counseling, we are learning a vocational training. What is a vocational training? Vocational training is for your bread and butter. What is a vocational training? How to utilize your spare time. That is taught in a vocational counseling. That a type of counseling also need to be taught. And nurses and nursing students, you have to remember you can help the people only when you are happy. You can spread the happiness only when you are happy. So first and foremost thing, whatsoever it takes. Now government has also started understanding marks are not important. So up to 7th standard, they have started with the grading. So what is important is a gaining a knowledge and living a life very peacefully and happy, healthy way, rather than only achievement through I have a bungalow, I have a car. This will not help. Okay, reaching out for support is a vital step in a journey towards mental well-being. So remember one thing, asking for help is not a sign of cowardness. Asking for help is a sign of courage. At least he has a courage to tell his near and dear one, at least that he is having this problem. Most of the people, they don't understand and recognize that they have this problem. Okay, so introspect yourself what problem you are suffering from, and accordingly take necessary further actions. Next slide, please. Organizers, I think I am disconnected. No, there is no response. Organizers, next slide, please. Very few slides are remaining. So, what is future direction shall be done? Integration with primary healthcare. We all know that whatever government has done, they have started Center of Excellence at Nimas. It's good thing, but you all know it's not feasible to give all over India care through one Center of Excellence. Then later on, they have started with community mental health centers. One is started at Sakalwara near Bangalore, run by Nimas. The other one is started at Raipurani near Chandigarh, run by PGI Chandigarh. That also failed. Later on, they have started with DHPU. Still, it is partly working. Later on, what is important? That is primary health care. Because what is important? Give care at the earliest. And we need to go on screening. Like we do anemia screening, HB estimation screening among school-going children. Same time, screening for any assertive lack of assertiveness, screening for any deliberate self-harm ideas, screening for any lack of self-esteem, that also has to be done. So psychological screening is also important. जसा above 40 we go for a screening of many things like ह्यांचं BP check करा, diabetes, sugar check करा, fasting करा, PP1 करा, PP2. Same thing, psychological testing, science 60, 50 above झाला तर त्याला mini mental status examination कर. That type of screening on a regular basis shall be done among schools and at all age group, at par of all age group, because everyone is having some or the other problem. As the age progresses, the different psychological problem starts coming. So primary, that mental health services has to be integrated with primary health care. Investment in research has to be done, as now there are many students are sitting here and faculties are also there. It's a good medium for me to tell you that university is giving a short-term and long-term grant, research grant. Utilize it. Do some good researches. Don't think about money. For students, they have stated that up to 50,000, or for teachers up to 2 lakhs they can get grant. अजून एक मजेची गोष्ट सांगतो. MUHS is planning to go for a 9. That means they have to show how much fund they have given for a research. So they have started granting. So Beti Ganga hai, hath dho lo. Utilize the fund for a good cause and for your and societal benefit. Promoting mental health literacy, fostering the resilience, bouncing back. Tell the people there is end is not this thing. Unsuccessfulness is not an end. Everyone fails in his life. Everyone sometimes will, because mental health is a frequently changing emotional feeling. No one can say he is purely mentally healthy, purely mentally sick. And community well-being has to be increased. Next slide, please. Okay, to conclusion of this, on this one World Mental Health Day, awareness is important, making the people aware that mental health is an important aspect of health which needs to be taken care of. Not only mental health, but social health is also important, spiritual health is also important. Collective action is needed. Not only frontline healthcare providers only will think, and they are not a full community try to understand. And future commitment to the sustained commitment to the mental health initiative is vital, achieving society where mental health being recognized as an integral component of overall health. Next slide, please. Call for action. Join what we can do. Join local initiatives. You alone is not sufficient. What you can do for yourself is to take care of your own mental health. Be confident. Read good books of great leaders, advocates for policies, and engage in a dialogue. Speak out. Whenever you are in need, speak out. Try to have at least one person in your life to whom you can share your each and everything. Maybe your spouse, maybe your kids, maybe your parents, maybe your friends, but at least one shall have one person in his life whom he can share all his things. Because bottle up thing leads a problem. भावना दाबून नाही ठेवायची, थोडे 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 एक्सप्रेस करायचे. Next, okay, where we can get resources about World Mental Health Day, because taking a class for one day, that also webinar where you are not known to me and everything is going online will not help. Go and report to WHO reports, Indian government initiative reports, NGO case studies and research publication. For further, we have also guidelines for first aid, uh, first aid for mental health given by released by World Mental Health Federation that I will share with you later. Next slide, please. Organizers, next slide, please. Call to action for mental awareness. On this mental health day, we call upon student nurses. You will be the future healthcare providers. It is even our health at the when we become too old will be in your hands. It is vital to understand and advocate mental well-being together. Let us promote mental health resources and establish support system. It's our duty is to take care of our health first, our psychological health first. Then only you will be able to take care of others. You will be able to give the things to others, only you have it. So if you have a happiness, you will be able to share it. Otherwise, it is very difficult. So first and foremost thing, you be happy. That is priority important. Next slide, please. Importance of mental health. No, it is very important to for a vital well-being. You need to take care of your mental health rather than just going on mobiles, playing, gambling, playing games will not help. You need to take care of your mental health, do some meditation, do some yoga, do some physical exercise. Mental health affects physical health, relationship, and work performance. Stigma education. Remember one thing, mental health is like any other illness. And don't feel ashamed. You yourself first to tell your friends and meet the psychologist or a counselor and report the problem to them. Support for students, student nurses, and mental health eh, needs mental health education for their well-being and a patient care. Sometimes what happens now while working in a psychiatric ward, you go on listening to the patient's problem, and you yourself get stressed out without doing any physical work. So understanding and discussing with the patient their own psychological problem also can be some troublesome. So you also need to take care of your mental health so that it will be benefited for you yourself first, and then you can be a good to the community. Next slide, please. Strategies for involvement, integration of mental health in a curriculum, not only in nursing but of a general population in a basic education. Creating support network whenever patients need, they shall be called upon, and patients shall not hesitate. It shall not be stigmatized. जसं आपलं दाताचं दुखणं झालं, आपण दात डेंटिस्टकडे जायला लाजत नाही, तसंच एखाद्याला डिप्रेशन आलं, टेन्शन आलं, तर मेंटल हेल्थ केअर प्रोव्हायडरकडे जायला त्यांनी लाजलं नाही पाहिजे. झोप नसेल वगैरे वगैरे वगैरे. Promoting self-care practices. You yourself start taking care of yourself first. Eat good food, do some exercise, mindfulness, meditation has to be done. Utilizing resources and services. Make the people aware. मी मगाशी सांगितलं टेलिमानस किती लोकांना माहिती आहे माहित नाही. Government has a counseling university. Our MUHS has a counseling facility for students, even referral services for psychological health, but most of them are not aware. Advocating policies change, encouraging student nurses to advocate for policies that emphasize mental health resources in education setting help to create a supportive environment. Next slide, please. Conclusion and call to action. Importance of action. Taking action on mental health within nursing is a vital thing because nurses first need to take care of themselves and show the people show the society their existence and they are helpful. Fostering the culture, creating a culture that values mental wellness in healthcare. Gyno advocacy support mental health initiative in nursing education across India. Next slide, please. So we have seen today that on this World Mental Health Day, World Mental Health Day serves as a global platform to raise awareness and reduce stigma surrounding mental illness. The 2025 theme highlights the urgent need to make mental health services accessible during catastrophes and humanitarian crises. Nurses are at forefront of mental health care delivery, providing emotional support, crisis intervention, and community rehabilitation in community itself. Focus of care has to be shifted from hospitalization to deinstitutionalized care. India's mental health scenario reflects both challenges, the treatment gap existing, limited professionals, and also progress, that is policy reforms, national programs, telemanas like 24 into 7, video calling helplines. Educational institution plays a vital role in preparing nurses with the skills, empathy, and resilience needed to address the psychological needs in emergencies. So it shall be starting from the early childhood. Building a supporting culture through awareness, policy advocacy, self-care ensures holistic well-being for both patients and caregivers. Together, we can create a mentally healthy society where care, compassion, and accessibility are central to health services. And moving on to last slide, I acknowledgements for all mental health professionals for working hard, tirelessly to treat the patients, to educate well the train students, also to the NGOs, community health workers, who rather than sitting in the cities and taking care of people in the cities, where they are going to the rural areas and providing care to the real needy people. And personal story can to contributors and like celebrities who are coming up and sharing their own sickness, mental health sickness, how they overcome it. बिकॉज दॅट इज ऑल्सो इम्पॉर्टंट. जसं उरी मूवी होऊन गेला तर सगळ्या लोकांना वाटायला लागलं आम्ही एअरपोर्ट, सगळ्या मुलांना वाटतं आम्ही एअरपोर्ट मध्ये जाऊ. ते भाग माग मिल्का भाग मिळून गेला, सगळ्या मुलांना वाटायला लागलं की आम्ही ऍथलीट बनाव. सो दिस सेलिब्रिटीज प्लेज अ इम्पॉर्टंट रोल. So thanks to all those celebrities also, and thank you organizers, our college, GD Pol College, and Matoshri College of Nursing, Nashik, principals, faculties, and students for kind listening and allowing me to share thoughts on World Mental Health Day. Thank you once again. And over to organizers, please.
Thank you, sir. We are open for question answer session. So if any questions from the delegates, please ask. Do we have any questions from delegates?
So, will you denote some key points regarding the mobile addiction as our participants are maximum students?
Basically, as per definition of addiction in psychiatry, it is not amount of time person uses it. It is not amount of time person uses it. For example, how to define a person is social addict or a drinker or dependent. Before moving on to substance dependence and mobile dependence, we will try to understand what is dependence. There is no concept of social dependent or social drinker in psychiatry. Like in psychiatry, we have a disease under classification of disorders of adult personality and behavioral syndrome associated with physiological disturbance and physical factor under year 50 to 59 and 60 to 69. Under previous classification of isolated, we have a pedophilia, a disorder of sexual preferences other than normal, whatever sexual preferences people have are comes under pedophilia. But the definition says that whether the person commits that, we will call it as a crime, or not commit as a crime, but urge to have that um, sexual relationship or whatever this thing is illness. Same thing happens in a disease condition like dependence. It doesn't depend upon how much person drinks, but urge to have a drink is known as a dependence. For example, there are people who drink only on 31st December or on some special occasions, but they go on thinking about that drinking throughout the year. That means they are dependent. This is the simple definition of dependence. Same thing happens in a mobile dependence. We have seen that people are shifting from uh, this psychoactive substance abuse. Psychoactive substance, basically, ICD-10, they have given two types of substance dependence. One is psychoactive substance dependence, and other one is non-dependence producing substance dependence. Psychoactive substances are basically, we have seen that alcohol, depression, stimulants, cannabinoids, and others. Under non-dependence producing substances, they have given antacids, analgesics, then people are addicted to steroids, vitamins, minerals, like that. But in ICD-11, they have clearly given mobile dependence. That mobile dependence can be of anything like social media dependence, gambling, gaming, use of mobile. And this is like, for example, two people are sitting in a classroom, and if one people opens up his mobile, take out his mobile, the other people cannot resist it. He has a strong intention. He is looking into mobile. I also shall take out my mobile and see it. So this all not only dependence producing and non-dependence producing substances, but mobile dependence is also doesn't depend upon the screen time uses of a person, but it depends upon the urge of a person to use mobile. This is also affecting nowadays with the different types of independence, and people need to be taken care of them. And as you all know, on ChatGPT, this AI are using various videos. People started uploading their own videos, their kids' videos, spouse video. That is also a bit risky. So just take care of it and don't use it. The restriction has to be there. Yes.
Any other questions?
Thank you, sir.
Thank you.
So delegates, any other questions? I think there is no questions from the delegate side. Thank you, sir, for your valuable insights. I'm sure delegates has again a lot of valuable knowledge from your words. I regret to inform you all that Dr. Devika Patil won't join us today due to family emergency. We will conduct her session some other day. Sorry for the inconvenience. All delegates are instructed to fill the feedback link which is shared on the screen and on their WhatsApp groups. Now, I request Ms. Mayuri Valvi, lecturer, Matoshri College of Nursing, to propose vote of thanks.
Okay. Am I audible to all? Good
Yes,
afternoon, everyone.
Madam, go ahead.
Good afternoon, everyone. Myself, Mayuri Valvi, lecturer from Matoshri College of Nursing. So it's an honor to deliver the vote of thanks for this insightful webinar. I would like to extend a sincere thank you to our esteemed guest speaker, Mr. Vishal Naikare, for sharing their valuable insight and expertise on World Mental Health Day. Your presentation was truly enriching and has given us ideas to apply in our work and lives. Special thanks to our organizing committee, Dr. Shaileja Date, Principal, Dr. G.D. Paul Foundations, INE KHARGAHR, Navi Mumbai, Dr. Jyoti Naikare, Principal, Siahat College of Nursing, Pune, Professor Mrs. Manisha Maske, Principal, Matoshri College of Nursing, Nasik, Dr. Supriya Kadam, Associate Professor, HOD, Mental Health Nursing, Dr. G.D. Paul Foundation, IIM Kharghar, Navi Mumbai. Miss Ayushi Singh, Clinical Instructor, Siंहगड College of Nursing, Pune. Mr. Gaurav Shinde, Clinical Instructor, Matoshri College of Nursing, Nasik. Your arrangement made this online session a success. We also acknowledge the dedicated volunteers and volunteers who worked behind the scenes to ensure the smooth webinar. And also thanks to our IT team of GD Paul Foundation, Navi Mumbai, Kharghar. And lastly, thank you to all the enthusiastic participants for their active engagement. Your presence and the interest helped to make this session meaningful. So now I request all the participants to fill the feedback form for the e-certificates. Thank you. So now I declare the program is over.
The feedback link is being shared in WhatsApp groups, YouTube, as well as Zoom chat box.
मॅडम झाले का मीटिंग?
Ending with this meeting.
हॅलो.
Sir, end the meeting, please.
ओके.